Welcome to Voices from the Field, the NAMA Next Gen podcast. I'm your host, Neil Nakash, and in this episode, I spoke to Dr. Kamran Mirza about the future of medical education, pathology, and global diagnostics. Dr. Mirza is a professor of hematopathology and pathology education at the University of Michigan. He also serves as the director of the Division of Education and assistant chair for education within Michigan Medicine's Department of Pathology. Dr. Mirza is the co-founder of PathElective.com, which is a free educational platform for pathology, and you'll be hearing a little more about this later in the episode. A fun and extremely relevant fact about Dr. Mirza is that he is also the co-founder of a podcast called PathPod, so he is definitely no stranger to the podcast world. Dr. Mirza has been incredibly supportive of NAMA Next Gen throughout the years, so I really cannot think of a better guest to have for our first episode. With that, here's Dr. Mirza with us today.
Thank you very much for having me, Neil. It's an honor.
So I guess just first starting things off, I wanted to hear about, your path towards becoming a pathologist. What particularly made you interested in pathology and in particular pathology, hematopathology? So can you just tell us a little bit about your journey?
Sure. So growing up, I didn't know, I'm the child of two doctors who actively tried to dissuade me from doing medicine. So I'm not the usual phenotype where two physician parents are kind of asking their child to become a doctor. I thought that I might want to be an architect. I was very much into art and the visual kind of fields, and my dad would encourage me to think about architecture more than medical school. But ultimately, I did apply to medical school and an art school. I'm from Pakistan, and I was hoping that I'd just get into one of them, and that would help me decide. Ultimately, I'm really glad that I chose medicine. It was, for lack of a better term, a calling for me. I'm still very visually inclined. I love the arts, but I'm really glad that I chose medicine. And during medical school, I think that I was one of those students who liked everything. As I rotated through them, I was inspired by so many physicians, and then what they were doing and how they were affecting healthcare. And as I rotated through multiple different specialties, I kind of saw myself fitting into many of them. And so that was confusing. I'm also the type of person who kind of doesn't really like the rat race. Like, if you
Hmm.
tell me that everybody's trying to do one particular thing, I don't know why, like organically, I'll just want to do something different. Like, it's just kind of part of who I am.
Uniqueness.
I don't know if it's unique or not, but I do
Yeah.
think, when I look back, I think I've made some decisions in life which are a little bit off the beaten path, and I'm
Hmm.
grateful for those. And so when I finished medical school and, we had some time to study for the USMLEs, I graduated from Pakistan at the Aga Khan University. And so we took some time to study after graduation so that we could come to the US. And at that time, I started rotating through a pathology laboratory. I was very inspired by one of our pathology faculty members, and I was very curious, what this field is. Like many medical students, I just did not know that this is a really amazing part of the House of
Yeah.
Medicine. And I'm so glad that I found it. I was initially very hesitant because I loved direct patient facing interactions. And as you and most of your listeners probably know, I mean, pathologists can see patients, but in general, we are behind the scenes. And so I was nervous about that and was thinking about whether I'd be happy with a career where I'm not seeing patients directly. And through a series of events, I ended up having to change my route and go into a PhD program before residency. And my PhD program really opened my eyes to the fact that, I was there for 4 years. I didn't see patients. I contributed to science and hopefully made some scholarly advances. And I realized that I don't actually miss my patients as much as I thought I would.
Hmm.
And so that really solidified for me the fact that, okay, you know what, pathology would be pretty great. And so I was lucky. I got into pathology residency. And then during that course of residency, because my PhD was related to the lung and like kind of vascular biology of the lung, I was studying the endothelial barrier. I thought that I'd probably just do thoracic pathology as my subspecialty. But then when I was training in pathology residency at the University of Chicago, I fell in love with the hematopoietic system in a way that I really was not even prepared for it. I think it's just such a fascinating system. It is really, really, truly incredible. And my hematopathology rotation solidified that that's kind of what I wanted to do. So I was very lucky. I ended up doing HemePath there at the University of Chicago. And I also did do some subspecialty training in thoracic pathology, which remains really close to my heart. But as you know, I'm currently a hematopathologist. That's my
Mhm.
day job.
You kind of touch on this, but pathology is like really being behind the scenes. A lot of medical students, when they first enter school, they don't really think of that.
Yeah.
But pathology is very essential. I mean, it affects such a wide range of clinical decisions and patient outcomes. So can you just elaborate on that point, about how pathology kind of shapes such like a wide range of things, even though it is behind the scenes?
Yeah, so there's so many generalizations about pathology and pathologists, and many of them are incorrect. And to be honest
Hmm.
with you, some of them are kind of like rude.
Yeah.
But pathology is an incredible specialty. It is very much a part of medicine, and it is very much a clinical specialty. I'm very much a physician when I look
Hmm.
at my patient's material, right? I may not be meeting the patient all the time, but I am definitely intimately acquainted with their material. And like you mentioned, you know, I don't know if these studies are really supported by exact literature, but I think the estimates say that 70% of a patient's electronic health record is full of pathology and laboratory data. So I think it's a field that touches every patient, right? From any well visit, from children all the way to grown-ups. There is pathology data in your EHR. The patient-facing physicians are making decisions based on laboratory or biopsy values. And I think that people don't realize it because I think in medical school, typically we come to teach the preclinical part of the medical education curriculum, which is kind of where we end up fitting. But, really we are very much part of the clinical aspects of it as well. So medical students see us as teachers of pathology.
Hmm.
And unless they choose to do an elective in pathology, they don't actually see us performing like physicians, right? They don't see
Yeah.
us making the diagnosis, clicking that report, and seeing the weight and the august responsibility of what we're doing, right? I mean, what we are typing out in a line is going to change the course of potentially a patient's life if it's malignant versus benign. And I think that from that perspective, there have been numerous kind of advances in how we are interacting with patients. There is, I would say, a national kind of movement now to make patients more aware of kind of who is part of their healthcare team and that we are one of the members. I mean, we're not the only one, right? We're
For
we're a
sure.
part
Mhm.
of of this amazing team.
But a big part.
Right. I mean, that has other
Yeah.
physicians, nurses, pharmacists, respiratory therapists, phlebotomists. I mean, there's so many people who are part of the team, but we are also part of a team, but we're the part that people don't think about. I often say this that, when you go to get a surgery, let's say the patient has a mass lesion and they want to get a surgery, they'll care about like, how amazing the surgeon is, which is really
Hmm.
important, right? And then they'll think about the nursing care. And of course, that's super important. And they'll think about all these things, but then the person who's actually going to be making the diagnosis on that tissue doesn't even really come to mind, right?
Yeah.
And it's kind of ironic in a way, right? Because you're going to go and have something removed and test it for whether it's malignant or benign, and ultimately it's the pathologist that makes that call. So the University of Michigan, I'm very proud that I co-lead the Patient and Family Advisory Council. We, talk to patients and we get patient and loved ones inputs into the work that we're doing. Our department actually features a bunch of patient faces and experiences. Members of our faculty are looking at how pathology reports can be more patient friendly. We actually have a pathology clinic where one of your founders, and now my next gen founder,
Mhm.
Dr. Ruba Ali Fahmy, is one of the breast pathologists who actually speaks to patients. And we're doing a number of really cool things. And so I think that the face of pathology is changing over time. But yes, we are very much behind the scenes, and I encourage every medical student to think about pathology.
When you were bringing up that stereotype that a lot of medical students or other people have of pathologists, I was very much guilty of that before I got to know, the work that you do, that work that Dr. Ali Fahmy does. I just kind of imagined like, okay, there's a lab, they have microscopes, and it's primarily research, and it couldn't be further from the truth. Um,
Right. I mean, I think,
yeah,
and it's okay. I mean, I'm glad that you came clean. It's all right. We forgive you. But I
we all
think
make
that
mistakes.
it's okay.
Yeah,
It's life is all about learning. So I'm
yeah,
really glad. And now look at that. You have a pathologist as your first guest, so it's okay. You're
yes.
forgiven.
Well, I appreciate your forgiveness, and you know, especially as someone who's coming into medical school and really wanting to keep an open mind, it's really interesting to hear about just like how large of an impact pathology has, and how this is something that I could possibly consider too.
Absolutely. I think that,
Hmm.
when you go into medical school, you will have in your mind a series of check boxes, which as you go through
Yes,
the different fields, you will either check yes or no. And it's not that you should think about becoming only a pathologist. It's just one checkbox. It's
for
not
sure.
for everyone, right? I mean, the way I am intellectually stimulated and how fulfilled I am by my specialty, different people find that same fulfillment in different specialties. That's the
Hmm.
beauty of humankind. The issue is that you don't even think about the fact that this is an option,
Hmm.
right? And so I think that if you start medical school with the knowledge that there is this option, right? I mean, people know about urology and anesthesia and psychiatry. I mean, all of them are very important fields, but typically they just don't know about this. So for any listeners who are about to start medical school or who are in medical school, just put that checkbox on, right? You can,
Yeah.
do an elective. It'll only make you a better physician, even if you don't want to become a pathologist. It'll make you more in tune to understanding what happens behind the scenes. You'll become a better, you'll really become, your patients will thank you for it, basically.
And kind of on that note of just kind of bridging that gap of understanding, I've really noticed that you've been very innovative in promoting pathology and advancing the field, and especially in pathology education. And you've done so using digital platforms, social media. Kind of just to shift to talking about these tools themselves. What do you think they get right about learning or promoting pathology, that our more traditional medical education models might sometimes struggle with or fail to do?
Yeah, so I think what we've realized over time is that every learner learns differently. Every teacher teaches differently. Medical students are self-directing a lot of their own learning. We know that many people starting, if not many people, all the people starting medical school now, at least in the United States, are digital natives.
Mm,
There's this divide between the people who print the PDFs and read them and the people who can't stand the printouts, right? I mean,
yeah.
we are really sitting at a point where even though the transitions have been a little bit blurred, the learner of today is completely different than the learner of 10 years ago and the learner of 20 years ago.
Hmm.
And so I think that, you're kind to call it innovative, but I think it's not necessarily innovation. It's just kind of staying ahead of or staying with the curve of how people are learning. So for example, if, the way you entertain yourself is with 15 to 20-second micro clips that, you just keep moving forward from, right? I mean, that has impacts on your attention span. It has impacts on kind of what entertains you, what keeps your focus. And then, how does that contrast to the fact that, learning typically is thought of as like a 1 hour lecture, which is didactic in one direction from a person to another person, right? It just doesn't jive, right?
Hmm.
And so the fact is that in many ways, it was really just bringing pathology education to the forefront, but then also trying to bring it to the learner, right? And we did this
Yeah.
by mechanisms that were all free. And so that means that if people are using them, which I'm really happy that they must be good, right? And
Hmm.
there are lots of paid platforms too. But I think that what we've learned over time is that um, there is value in thinking outside the box of how learning happens, right? I mean, there is an incredible value within the institutions of medicine that teach medical students, right? Because that is where the deep learning occurs. That is where they really understand the nuances of it. And so you cannot really take digital platforms or social media based learning as having the same depth as what is really required to become an adequate physician, right? And so,
Hmm.
we have to be very clear that these resources can be supplemental tools that help people become better physicians, but they can't be the only tools,
For
right?
sure.
And so a lot of people criticize that because they're like, oh, well, this tool is, social media is this place where it's an echo chamber and like people are taking selfies and doing all of this and that. Yeah, that's what it is. we're
Hmm.
not we're not we're not faking it. I mean, it is really much a place where there's a lot of self promotion, there is a lot of misinformation, but that does not mean that there isn't value in having a good product of education out there in micro learning bites, right, that people can learn from. And I think that so make no mistake, we're not trying to say that it's anything more than what it is meant to be. I think of it as CME light. It's like a really easy way of learning. Like just today, like a couple of hours before this podcast, I was like scrolling through my social media feeds and I learned like three things.
Yeah.
Right? I mean, I'm a professor of pathology. You should always be open to learning three things, right? Or
Hmm.
four things or five things every day. And I think that, for me, it became an avenue to bring pathology education and information about pathology, which is my passion, right, to the
Yeah.
forefront. It allowed people to hopefully learn from them. And I think that digital platforms can be interactive in a way that didactic lectures cannot be. And I think that, now with the evolution of augmented intelligence and the way people are probably going to be getting a bunch more information over the next decade or so, I think that, digital technology will be a key part of that.
Mhm.
And I think that, in that sense, we really need to be looking at curricular innovation and looking at kind of how we are teaching the medical students of the future.
I mean, it really sounds like, adapting to the situation because people are right. Sure, social media can be an echo chamber, but at the same time, are we going to let it remain an echo chamber of misinformation and
Correct.
disinformation? Or is the way to approach it to actually engage students, especially in this generation where social media is a not maybe not the primary, but a major source of education for a lot of people, including myself.
I mean, I think that you really hit the nail on the head in the sense that I think that we have to avoid silos being so siloed, really. Like, I mean,
Yeah.
that there's no cross-pollination. I mean, I think it's happening if you look at social media, like, the political discourse is so
Hmm.
siloed, right? People are just in their own bubbles. No one is kind of convert. Like, we've lost our ability to kind of converse. I
Yeah.
think that, in that sense, we shouldn't lose our ability to speak about misinformation, to be able to say things, because we are qualified to say, to really lean into the
Hmm.
lanes that we are specialists of, right? And talk about that. If, for example, if I want an opinion about my car, I will go to a mechanic who is an expert in it, right? And similarly, if somebody wants an opinion about the immune system or the hematopoietic system, please come to me. I might
Yes.
not be the expert, but I can tell you if something is a leukemia or not. And there are so many voices. And so, yes,
Hmm.
we have to sift through, I would say, the garbage of what might be out there. But again, I don't think that that should take away the very niche value that those types of platforms provide. And I think that, the reach, if I think about it from from not a political, from a scalable perspective, think about how, like, PathElective you mentioned, we founded it a couple of years ago. It's had over 4 million views in the whole world, right? I mean, and so that
Yeah.
means that, like hundreds of thousands of people are learning from it. And I think that that's pretty powerful. And that wouldn't have happened if there wasn't a digital
Mm-mm.
technology or a social media based kind of advance to that.
Exactly on that point of scalability. Like you said, with didactic lectures, of course, they're essential, but they have their own function that's separate from digital platforms or social media that
Right.
actually have that capability of reaching that wide range. Um, sort of just on the conversation of education, did you always know you wanted to be an educator, sort of when you were going through your pathology education and training, or did this come to you later, I guess?
Yeah, I mean, I don't know if there was an aha moment, but I do
Yeah.
kind of, I think I see the framework of who Kamran Mirza is to be very much aligned with, I think, educating other people. I have said this before, that I find that it's criminal if somebody teaches you something and then you take it to the grave and
Hmm.
don't teach other people. It's really like a gift that, other people have given me. I haven't learned on my own. People
Yeah.
have taught me. And I think that it's so valuable to think about, giving this gift of learning and education, because I think it can open so many doors. It, can, really inspire people. It can open brains and minds and thinking. I did kind of think about the fact that I want this to be part of my professional journey. And at the University of Chicago, I did do a fellowship in medical education. It's called the
Okay.
Merits Fellowship. And so that kind of gave me tools like, for curriculum assessment, et cetera, to kind of give me the structure and the framework of how to deploy educational technology. So I think that was really beneficial. But yes, I don't know when it was, but I've been very, very fortunate to be inspired by some incredible teachers. And so I think my way of moving it, paying it forward,
Hmm.
is to teach.
I mean, just looking at you, I see you paying it forward. And I
I'm
know you
glad.
said innovative isn't the word, but maybe adaptive or adaptable, and kind of like,
Flexible.
yeah,
Yeah.
flexible. And really, I'm, just looking at your social media, I see the many different ways that you're being flexible with learning. And something that I saw maybe it was a week ago or just a few
Yeah.
days ago was the VR. So can you just speak a little bit about that? How you're, I guess, experimenting or testing with VR and how that could be used to teach pathophysiology?
Yeah, so actually, there's a really great group on campus. Please follow them on Instagram. You can find them through my page, that are looking at OXR technology and VR in, in a variety of things, and they have like this very, very cool program that they have. Um, I think that so when they interacted with me, I thought that there would be a really amazing kind of education use for it. And so I think that the recent things that you saw on Instagram were a project that we're doing for pre-med undergrads at the University of Michigan, looking at whether VR-based technology versus kind of 2D technology is, what's the difference between their learning, right?
Hmm.
And so we're going to be doing an experiment. I can't say too much about it because that'll give it away, but,
Fair enough.
hope, if you listen to this, like really, sign up for that, basically. But it's incredible, right? I think that if you think about pathology, a lot of the orientation of cells and tissues and structures can be, so some people are very three-dimensionally oriented. Like, some people are really good with maps and directions, and some
Sure.
people are not. And I think similarly, when I see a lot of students, not everybody's on the same page with an understanding of, oh, this is this type of section or this is that type of section. And then what we're doing in pathology is, whether we use digital technology or whether we use microscopes, what we've done is we've converted a, a tissue into a two-dimensional image
Hmm.
and then faked it with like, color, fake color in it, right? With like staining.
That's,
And so
yeah.
so often part of the problem is really that, the trainee can't understand kind of how we've created that imagery or kind of how that aligns into the human, like, how it would be in situ. And I think the VR is kind of cool because you can, go into a human body and pull things
Hmm.
open and turn things around and they kind of be like, oh, this is what the section is like, right? I mean, and so it's not cool just to be cool, right? Because VR
Yeah.
is cool. I think that there really are, I would say, points of pedagogical value, right? When we think about educational discourse, that technologies can do.
Hmm.
And so when you look at 50 years ago, when you look at how people were studying medicine, and there was a Gray's Anatomy book, and there was a black and white drawn image. And
Sure.
then you moved into when I did medical school, and we had Netter's Anatomy, and we had this beautiful, gorgeous paintings, that were three-dimensionally oriented.
Yeah.
And now it's 2026, and so maybe there's holographic stuff, or maybe there's virtual reality stuff, right? I mean, what we're doing is trying to understand the human body, and these are just other different ways to basically achieve the same thing.
Yeah, I think it's really interesting, especially with VR, because of course some nuances will be lost, but much less than a two-dimensional image that is, as you said, nicely colored, distorted in a specific way that a pathologist isn't actually looking at, such a thing. So again, I really commend you on being adaptable, innovative in the field. And yeah, so you've been you've been in the pathology field for about a decade now, correct?
Yeah, so I
Yeah.
finished training in 2015. So like with, 15 years with training. Yeah.
15 years. So, okay, with training, even longer than a decade. I
Yeah.
guess in those 15 years, I mean, this is going to be a very multi-part question, but in those 15 years from your experience, what have you seen change the most in pathology? What has stayed constant? And what do you think, I guess, will change in the near future? Not, super far out, but just maybe within the next 10 years.
Yeah. So, I guess I'll answer the question not really thinking about the 15 years, but in general, thinking about like the last couple of decades. I think that
Sure.
pathology has been a very unique and very cool part of medicine in how it has adapted to technologies. You talk about the flexibility on education. You
Hmm.
know, when you look at cells, let's say when you look at, lymphocytes, when you look at them, you can guess if they're a B cell or a T cell if they're very specific morphologic forms, but in general, you don't know what they are.
Yeah.
And 2, 3 decades ago, or maybe 4, 5 decades ago, when you looked at them and there was no techniques that could phenotype them to study what antigens are on their surface, you were basically just guessing. And then phenotyping techniques came in where now we can study what antigens are on the surface. There are different ways to study that. You can do it by special staining, you can do it by flow cytometry. There's multiple ways that you could do it. Then, there was a time when we didn't really understand what the genetic or cytogenetic underpinnings of diseases were, right? And,
Hmm.
in pathology, we started understanding the role chromosomes might play, translocations might play, genetic mutations might play. And so, really, over time, if you think about it, how pathology is practiced today and how pathology was practiced, 30 years ago is completely
Hmm.
different. And in every stage, people were like, oh, this technology is going to take over pathology. This technology is going to completely remove a pathologist, right? But the truth is, it didn't. It
Yeah.
did modify how we practice. It
Hmm.
made our diagnoses better. It made our prognostication stronger. It made our classification systems, more aligned and streamlined. We were able to study what effects are happening to the patient based on treatment, what their outcomes are like, and really refine and re-refine our classification system. So I would say that the technologies that I'm using today, certain kinds of technologies, weren't being used 10 years ago
Hmm.
or 15 years ago, which already is a move in the right, I would say, in a more technologically advanced direction. And now that, but especially in pathology, we are part of a handful of centers here at the University of Michigan where we are almost fully digital now. So
Yeah, wow.
we're not moving around slides, and we're
Hmm.
seeing, we're seeing
Yeah,
the cases on our screens. And we have a world-class genetics unit here, genomics and genetics and molecular pathology. And so I think that with all of that, we are sitting on very fertile ground for
hmm,
computational analysis and augmented intelligence to be the next ancillary tool, just like Flow was or Special Stain was, that we can start incorporating. And again, to do the same goal, be better doctors for our patients, give them a
for sure.
more precise, a more consistent, more elegant kind of diagnosis. And I think that if, for example, some redundancies can be removed or some inconsistencies that are just based on, user to user variability can be taken away by mechanical means, we welcome them. I don't think that AI will take our jobs entirely, but yes,
Hmm.
AI will change the practice model. It will certainly change, I think some people say, oh, AI will replace pathologists. I think AI will replace those pathologists that don't embrace AI, right? I mean, I think that,
Sure.
you have to kind of embrace the technology in order to stay relevant. And so I think that we're at a very exciting time. Things are going to change. And I think that it will likely be, the computational and augmented intelligence based era, which I think has we've just uncovered like the surface of this. I mean, I think it'll go deeper.
Hmm.
There's so many people working on so many amazing projects, and I'm very excited to see where it all goes.
Yeah, we often, when we're speaking about AI, we often hear about the doom and gloom and, all the negatives, but that also means that it's opening up new frontiers, advancing the work that pathologists can do, or even the scale that they can do, as you sort of like have hinted on. Um, I know you're someone who's involved in the Center for Global Health Equity. And, as part of that global health work, how do you see AI or just digitization generally really impacting the field of global pathology or global, I guess, disease surveillance or treatment?
Yeah, I think that it will have a massive impact. I think that when we think about global health, we should think more and more about global diagnostics. There's
Hmm.
no global health without global pathology. I mean, yes, of course, like, there are some fields that don't necessarily need diagnostics. Like if a surgeon is going into a low resource setting and fixing a cleft lip or a cleft palate, right, that's a very surgically
Sure.
oriented procedure. But when we think about global cancer care, right, there's no diagnosis without pathology. And how can you do cancer care without that? And so
Mhm.
I think that, there are lots of limitations that are in resource poor settings that we need to be understood on the ground, right? You cannot develop a solution sitting here in Ann Arbor and then go and deploy it. You have to kind of figure out what it is on the ground that people need. In the places that I have had the really great fortune of helping or working in, through the Center for Global Health Equity or through our global pathology program here in the department, it always starts with the needs assessment on the ground and in a way trying to set up low resource settings, to be centers of excellence for other low resource settings, right? I mean, the
Mhm.
idea is that they can all support one another and that we, either by grant funding or, by philanthropy or whichever way, kind of try and find the tools that will help set them up to be the most successful based on what their need is, right? I mean, in
Mhm.
parts of the globe, you won't get a diagnosis for 7 weeks, potentially that diagnosis you get here in like 7 hours, right? I
Mhm.
mean, those are incredibly variable kind of things, and I think that digitization, if, for example, there is electricity and if there is access to the internet, I think digitization shortens those gaps, right? I mean, it may
Sure.
not be applicable to every single low resource setting, but many low resource settings actually can be, gain value from those. And so I think that, and this doesn't have to be low resource settings in other parts of the world. It can be low resource settings even within
right
the
here.
United States. There
Hmm.
are areas, large vasts of states where, pathology departments aren't like next door, and, the things have to move to larger centers where pathology departments exist. And so I think that there can be tremendous value in considering um, modernization of pathology in a way from the global health lens. I think that there's
Hmm.
lots of potential benefit there.
Definitely, I'm, hearing both globally, but also domestically. We often talk about how rural areas are, among the most underserved areas and among others. So it'll be interesting to see how, augmented intelligence, digitization, and all these other advancements in technology can really help, I guess, shorten that gap.
Yeah.
Um, just kind of because we're on the topic of, thinking about the future and, just knowing where pathology and medicine more broadly, where these fields are headed, what would you encourage medical students or even trainees to do now, that'll better position them for the next era of healthcare, especially in, in relation to technological advancements?
You know, um, that's a tough question.
Yeah.
I think medical students should understand that healthcare is a team sport,
Hmm.
and there are a lot of variables that go into taking care of patients, and medical students and the future physicians of the world are really the nidus or the center of that team, right? And I
Hmm.
think that um, staying open and flexible to
Hmm.
newer ways of kind of deploying medicine is probably going to be of value, because otherwise they risk being redundant, right? Or not relevant. They are also coming out of medical school or in medical school and matriculating at a time when medical knowledge is doubling very fast, right? I mean, it used to be decades when, before medical knowledge doubles, but I think now I think it doubles in 70 days. Don't quote me on that, but like in a
It's
matter of like
insane.
2, 3, 4 months, the amount of medical knowledge we have is doubling, right? And therefore, they will come out at a time when they may not be able to have a handle on every single aspect of the
Sure.
medical knowledge that they need to know. And so they need to be very cognizant of how much they know and where they need to pause and find out more before doing something. So I think that the model is changing, but I
Hmm.
think that they're very well prepared for it. I think that for many of the medical students that I know, if not all of them, they go in with their eyes wide open about what the
Yeah.
challenges and what the opportunities are. So I would say stay flexible, make sure to take care of yourselves, and think about think about the future of medicine with an inspired lens, right?
Inspired.
It's very
Okay.
easy to become kind of, cynical and doom and gloom, but don't do that. Don't do that.
Yeah.
It's an incredible field, and it's an incredible life, and it's so rewarding. And but it's changing. So just
Hmm.
be very aware of the changes so that you can adapt accordingly.
I really appreciate your advice on that because even personally, it gives me a lot of optimism. Again, we often hear about the doom and gloom associated with technological advancement, but it really is just widening the frontiers. And by being flexible, as we keep saying, there clearly is a way to adapt for the future.
Yeah.
Um, I guess one final question, and this is something that I want to start doing with all podcast episodes, is at the end, I'm just, curious. Any book, media, any book, media, TV show recommendations that you have for me or for the audience? Could be anything. It doesn't have to be pathology related.
Okay, good. Um, so what am I watching? I don't know. I'm watching reruns of The Closer on Netflix, I guess. I like kind of police dramas or
Hmm.
detective shows. Of late, one of my most favorite shows was called Dark on Netflix. It's kind of like
Dark.
time travel type of kind of a thing. I think that's really cool. And if you were to read a book, I would say read The Gene.
The Gene. What is the Gene about? Or synopsis?
So, it's there was effectively, I think that it's really cool to kind of think about things at a very molecular and kind of cellular and genetic level. And I think that I don't want to give it away. I mean, it's kind of a
Sure.
very famous, kind of a popular book, and so, but I
Okay.
think that it's worth a read. It's kind of a big book to read, but
Okay.
it's worth it.
Worth the challenge then.
Yeah.
But thank you so much for, joining us on the first episode of Voices from the Field. We look forward to having you on in the future again, especially if you're interested. But I just really want to say thank you. Thank you so much.
It was my pleasure to chat with you. Good luck with it, Neil.
Thank you so much. All right. Take care, Dr. Mirza. Thanks for listening to Voices from the Field, the NAMA Next Gen podcast. If you enjoyed this episode, please make sure to follow us on Instagram, Spotify, Apple Podcasts, and YouTube to stay updated on our upcoming episodes. We'll catch you next time on Voices from the Field.